reason why women who've had multiple sexual partners, who've had sexual partners at a younger age, are more likely to develop cervical carcinoma. Perhaps, and this is a lot of people think this now, that the virus is transmitted to the cervix from the man that the woman has sex with. Diet, we know, is a factor in many sorts of tumour. Now there's another video called Health Advice in the West where we deal with this in some detail. But I'll just mention a couple of points now. The current advice is 5 a day. This means eat 5 portions of fruit or vegetables a day. And the reason for this is 2 reasons basically. One is that fruit and vegetables contain fibre, and fibre perhaps reduces the incidence of cancer of the colon. But the other reason is they contain lots of vitamins and minerals, and some of these act as so-called antioxidant agents, and they perhaps keep the DNA, the genetic material in the cell, in good condition and prevent tumours developing. So diet, fresh fruit and vegetables, perhaps reduces the chances of some cancers developing. Whereas diets high in protein and fat perhaps increase the chances of some tumours developing. So people that eat a lot of meat on low fibre diets tend to have a higher incidence of cancer of the colon. People that eat little or no meat and eat a lot of fibre virtually never get cancer of the colon. So the traditional African diet, for example, low in meat but very high in fibre, results in a remarkably low incidence of colorectal carcinomas. Whereas the diet in the West, which is higher in protein, higher in fat and often lower in fibre, is associated with a high incidence, a high risk of colorectal carcinomas. So diet perhaps is a major factor. The main thing is eat plenty of fruit and vegetables, fresh things, and eat less fat and perhaps eat less meat and things containing a lot of protein. For example, there's a very good correlation between the amount of fat in the diet in various countries and the incidence of breast cancer. It doesn't mean to say it's the fat that's causing the breast cancer, but it could well be an etiological factor. So the rule of thumb, fruit and vegetables, cut down on fatty things. So diet, certainly a factor. Hereditary, well, a few tumours are directly genetic. They're inherited in terms of Mendelian inheritance, but they're fairly common. But many conditions do seem to run in families. Now, of course, there's 2 possibilities here. One is that it's the environment that family generates that passes on the predisposition to the tumour, and the other is that it's some genetic thing in the family. So if parents have died of a particular type of tumour, it's worth keeping an eye on the offspring to make sure they don't develop the same sort of tumour. And very often there might be advice that you can give. So for example, if the parents have died of lung cancer, it's particularly important that the children don't smoke. So hereditary effects very often carry genetically, although not transmitted in classic Mendelian fashion. Rather, someone perhaps inherits a predisposition to a particular tumour. Now, hormonal factors are involved. For example, estrogen can stimulate breast cancer. When you give estrogen hormone replacement therapy, breast cancer becomes more likely. And there's many other environmental factors that we could spend a lot of time considering. And we'll look at these in more detail in the second part of this video. Age, basically, as a rule of thumb, although it's not always, well, it depends on the type of tumour, but very often, the older you are, the more likely you are to get cancer. In fact, there's an old saying that if you live long enough, you'll get cancer, and basically that is true. Because most types of tumour, not all, but most types of tumour, become more common as we get older. Initiators, promoters, and multifactorial aspects we're going to look at in the second part of this video. What we've done so far is introduce the idea of cancer and malignant disease. What we're going to do now is look at the nature of cancer in some more detail on the second part of this video. On the second part of this tape, we're going to look at cancers in more detail. And as time allows, we'll look at the management of cancers as well. And what I'm going to do first of all is run through a few of the notes, reviewing partly what we've said, and adding a few details as we go. So we've said that cancer is about 20 to 25% of deaths in the Western world. And it's a mathematical fact that your chances of dying double every 8 years over the age of 30. And for most cancers, fortunately, in one sense fortunately, the older you are, this is age along here, increasing age on this axis. So from say 0 to say 100 up here, something like that. And this is the number of cases of a particular cancer. Then the number of cases increase with increasing age. The older you are, the more likely you are to get the tumour. And in a sense that's good, because it's better to die when you're old than when you're young. But some cancers do have a peak age. For example, testicular carcinoma is more common. I don't know the exact shape of this line, but it's more common. And the peak age for testicular carcinoma is 31. And there's various other tumours that have peak ages. Some leukemias are similar to this. But for most cancer, it remains true that the older the individual, the more likely it is they're going to get cancer. We've said cancer is excessive multiplication of cells, which is rapid, uncoordinated, in other words, is out of control. This results in the formation of a tumour or neoplasm, perhaps due to loss of contact inhibition. Problems can arise because the growth of tumours may outstrip blood supply, resulting in necrosis, ulceration and infection. And also, as we said, tumours may be primary or secondary. But what I want to do now is go on and focus on the differences between benign and malignant tumours. So let's now focus on the difference between benign and malignant tumours. Now we've said already that the main difference is that benign tumours don't spread and malignant tumours do spread. So malignant tumours metastasize, that is the main difference. But let's look at a few other differences between benign and malignant tumours using this checklist. And first of all, we're going to think about benign tumours. What about the growth rate of benign tumours? Well, usually this is fairly slow. Benign tumours tend to have a fairly slow growth rate. But if we go over here, we've got a list of the same properties but for malignant tumours. And in malignant tumours, very often the growth rate is fairly fast. Not always, but often. So benign tumours tend to grow slowly. Malignant tumours often grow much quicker. Now let's think about local invasion. In benign tumours, the tumour is usually round because it grows evenly. And what it does is, as it grows, it compresses surrounding tissue. So very often the tumour's encapsulated in a capsule made of compressed surrounding tissue. So it doesn't actually invade local tissues, but it can put pressure on local tissues. So there can be pressure, but not local invasion. Whereas in the malignant tumour, the whole thing it grows in an unpredictable way. So a malignant tumour might be this sort. If you map the malignant cells, what it tends to do is put out like finger-like projections into the tissue, and these can grow. So they invade local tissue. So invasion of local tissue in malignant tumours, yes. Invasion of local tissues. And in fact, if we look back to the benign tumour here, local invasion, there is not local invasion, just pressure. And very often benign tumours are mobile because this can move around because it's not well anchored in the surrounding tissue. So very often benign tumours are mobile and not well anchored. But if we look at the malignant tumour, we see this because this infiltrates the tissue, it's well anchored in the tissue. So malignant tumours are often firm. So firm tumours are often of the malignant sort that seem well infiltrated into, or highly infiltrated into local tissue. Very often they're harder as well, not always, but very often harder. So local infiltration, benign, no. Malignant, yes. Thinking about metastases, as we saw with that huge, horrible thyroid tumour earlier on, there was no deposits anywhere else. So metastases, do benign tumours metastasise? No, they don't. That in fact is the definition of a benign tumour. It doesn't metastasise. Of course, the malignant tumours do metastasise. As we saw earlier on, the examples of the bronchogenic tumour and the colonic carcinoma, they metastasise. They spread to other parts of the body. Let's think about this idea of recurrence after resection. For a surgeon, it's a relatively simple matter to take out this malignant tumour. Sorry, this benign tumour. Cut there and there. Take the whole thing out. And it's very likely you'll get the whole tumour. This can all come out. Or even sometimes they can just dissect around the capsule of the tumour, as we saw in the case of the thyroid. And these will not recur, unless, of course, there's incompetence and some of the tumour is actually left, then it can recur. So recurrence after resection with benign tumours, no, they tend not to recur because it's easy to get all of the tumour tissue out. But if we look at the malignant tumour and look at the shape of it, well, these do tend to recur after excision, because suppose the surgeon takes a line like that and like that, and he takes out all this tissue. Will that tumour recur? Well, the answer is yes, it will, because he's missed one of these finger-like projections, which is very easy to do. And the whole tumour will recur from this one little bit of these few malignant cells that are left. So unless it's caught early, at an early stage of the tumour, and the tumour is completely removed, then because a few cells can be left in a finger-like projection, even just considering local spread without considering metastatic spread, recurrence after resection, unfortunately, yes, malignant tumours do tend to recur after resection. Now, what about systemic effects? Well, in benign tumours there can be systemic effects, but they're due to the local effects of the tumour, if that makes sense. So, for example, if the tumour is growing in the brain, that could have an effect on all of the body. For example, it could raise the blood pressure. But it's because of a local effect of it, or it could compress an airway or something. But there's not general systemic effects from benign tumours. So normally it's true to say that in benign tumours, are there systemic effects? No. The effects are local. So benign tumours, not usually systemic effects. Malignant tumours, on the other hand, are the systemic effects. Well, there's spread, and as we'll see later, there's other systemic effects called paraneoplastic effects. So yes, very much so. Malignant tumours do have systemic effects. Let's think about the cytology now, the shape and structure of the cells. In benign tumours, these tend to remain normal. So the cells tend to look normal in the microscope. But when you're thinking about cytology with malignant cells, then the cells themselves are abnormal. The cells are usually big, there's irregular shaped nuclei, and there's mitotic figures. So big cells, funny shaped nuclei in those cells, and the mitotic figures, what this means is that when a cell divides, you can actually see the dark stained chromatin material in the cell as it divides. Sometimes you see it as chromosomes being pulled apart. A mitotic figure, in a sense, is a cell caught in the act of cell division, a cell which is not at interphase. So these mitotic figures, if there's a lot of these around, if it so happens you've caught a lot of cells in the act of division, what it means is that the rate of division in that tissue is high. There's a lot of cells dividing. And of course, this is the nature of malignant tissues. There's lots of cell division going on all at the same time. Let's have a look at a diagram now of normal and abnormal cells to clarify this point. So here we see a diagram of some ordinary or some benign cells, and there's a nucleus dark stained in the middle there with an even nuclear membrane, cytoplasm and cell membrane. And these are normal looking cells. Smooth nuclear membrane, so they look smooth, that's nice and smooth around about there. Regular shape and size of the cells. The cells look like they're from the same tissue, and we've seen this many times on these videos when we've looked at cells in the microscope. And the ratio between the nucleus and the cytoplasm is low. In other words, there's a lot more cytoplasm than nucleus. So there's about 1 unit of nucleus to about 4 of cytoplasm in benign cells. So nice, smooth, regular looking cells, quite recognisable of the tissue that they came from. Malignant cells, on the other hand, are very strange, irregular looking cells, and the nuclei are large and irregular with irregular staining chromatin in the nucleus. So cells of different shape and size, referred to as pleomorphic. So the cells are pleomorphic, different shapes, different sizes. The nuclei in these cells are very large, so the nucleus to cytoplasm ratio is high, about 1 to 1. So in this cell, for example, we can see that occupies, the nucleus here, occupies about the same area or the same volume, really, as the cytoplasm, which is very, very abnormal, of course. And the cells have irregular shaped nuclear membranes. So the difference there between benign cells and malignant cells in terms of cytology. Now, in benign tumours, the histology, very often there's preserved function of the cells. And indeed, this can be a problem sometimes. If there's a benign tumour of, say, the thyroid gland, then sometimes that produces thyroxine and the patient will become thyrotoxic. So very often the function of the tissue is preserved. But in malignant cells, typically in histology, the function is changed or is indeed absent. The cells no longer function as they should, considering the tissue which those cells arose from. Now what we're going to do now is look at causes of cancer in some detail. And of course the challenge for you is, what cancers are there in my area, round about where I live, the people I work with? And thinking about those cancers, do I know what causes those cancers? So if you're seeing a lot of colorectal carcinoma, for example, why is this? And when you work out some of the etiological factors for the cancers you're working with, you can then advise the rest of the population, that is the healthy population, how to avoid getting this cancer. Very much the role of the nurse as a health educator, promoting health in the community. Now, I can't tell you the causes or the etiological theories for every tumour type. There's too many, there's hundreds, thousands. So what we're looking at is some examples here. And hopefully this will be enough to start your thinking off about how you can prevent cancers where you live, where you work. So let's start thinking about causes of the cancers. And the first one is radiation. Now, a lot of research was done on this after the nuclear bomb explosions in Hiroshima and Nagasaki. And there was an increase in certain cancers like leukemia. But in a sense, this was an atypical case because this was where there was high exposure for a short period of time. And that, of course, is dangerous, but what is also dangerous is low exposure for a long period of time. And my view is that any increase in the amount of radiation causes increased risk in the likelihood of some cancers developing. I'm not a believer in the idea that there's a safe increased amount of radiation. Now the chances may be very small that you get increased problems, but nevertheless they are probably there. So ionizing radiation. And what actually happens is ionizing radiation breaks bits off the DNA or alters the genetic material in the cell and actually affects the DNA directly. And of course, when we're talking about radiation, ultraviolet light is a possible source of ionizing radiation. And ultraviolet light, of course, is present in the sunshine. But it's getting worse now because of this ozone depletion that we have. Because of various atmospheric pollutants that are affecting the ozone, then the ozone is no longer filtering out the ultraviolet, and more ultraviolet is getting through to ground level. And ultraviolet can cause skin cancer, especially if the skin is burned. So it's very important to avoid sunburn, especially in children. In Australia, they developed a saying for this. It's kids cook quick. Kids, children, exposed to the sunshine can become sunburnt very quickly. And they've developed another saying in Australia. It's slip, slop, slap, if I can remember it. Slip, I think, means slip on a t-shirt. So your body is covered. Slip, slop. Slop means slop on the sun cream. That's protective sunblock. Slip, slop. What did I say? Slip, slop, slap. Slap on a hat. with the third one. Slap on a hat. So slip, slop, slap. So two very important points. Kids cook quick. Cover up the body. Put on sun cream. And wear a hat to prevent exposure to the ionizing effect of the ultraviolet radiation and prevent sunburn. Because white-skinned Australians who spent a lot of time in the sun get an awful lot of malignant melanoma. And it's increasing. The amount of malignant melanoma is increasing. There's various reasons for this, but perhaps the main reason is exposure to excessive amounts of sunlight and ozone depletion, unfortunately. So advise people to avoid excessive exposure to ultraviolet light. So radiation as a possible cause of cancer. Chemical carcinogens. Well, there are many chemical carcinogens. One of the first ones that was discovered some time ago now was that chimney sweeps who were exposed to soot got a lot of cancer of the scrotum. So exposure to soot leading to scrotal carcinoma. Some aniline dye industry workers who are exposed to some sorts of dyes, cloth dyes, get more cancers in the bladder. Workers in the plastic industry who are exposed to vinyl chloride have an increased incidence of liver primaries, in fact, liver cancers. After the Vietnam War, there was an awful lot of deformed births and cancers as a result of a chemical carcinogen that was used as a defoliant agent. It was called Agent Orange at the time, and it contained dioxones, very nasty carcinogens called dioxones, present in some incinerated things as well, produced by incinerators. So dioxones are chemical carcinogens. What else? Benzene. Benzene is a chemical carcinogen. So when you're filling your car with petrol, that smell you get, that petrol-y smell, is actually the benzene, and the benzene is very carcinogenic. So when you fill your car with petrol, you probably inhale about 20 micrograms of benzene, which is a bad idea. So don't lean over the petrol cap when you're filling your car with petrol. Look away and don't smell the petrol because the fumes are carcinogenic. So quite a few chemical carcinogens there, some occupationally related. Asbestos we've mentioned, asbestos causing mesothelioma and lung cancer. While we're on this subject, there's another possible cause of chemical carcinogens, and this is moulds on food, so-called aflatoxins. For example, peanuts in some parts of Africa, where peanuts are a large component of the large protein part of the diet. The moulds that grow on these peanuts can contain aflatoxins, and again they can cause cancers, particularly cancer of the liver in that particular case. So moulds and aflatoxins. So in other words, there's many agents, chemical agents in the environment that can lead to malignant changes and cause cancer. Why is it there's so much stomach cancer in Japan? Well, one reason might be the high amount of salt in the diet. That might be one factor. There's other factors. So exposure to various chemicals leading to various types of tumour. And of course, the answer is to avoid exposure to these etiological agents. So, smoking. Yeah, well, smoking is fairly obvious. Actually, we'll mention smoking. It's not that obvious. Smoking causes more cancers than you would think. Obviously, it's going to cause lung cancer, but it might surprise you to learn that smokers are more likely to get cancer of the bladder and probably other cancers as well, because the chemical carcinogens in the smoke, as well as affecting the lungs, are actually absorbed into the blood and circulate all around the body. So other cancers can be caused by smoking, other than the obvious lung cancers. In fact, smoking is the major preventable cause of death all over the world. It's very common everywhere, and it causes so many conditions. It actually, in the UK, it causes more deaths through heart disease than cancer, and it causes an awful lot of deaths through cancer. So really, we do need to advise our people that we work with very strongly not to smoke, and young people not to start, because it just causes so many health problems. Not the least of which is not the cancer is not the least of these. It causes a lot of types of cancer. So if people just stop smoking, the incidence of quite a few tumour types would reduce quite significantly. So smoking, very major cause of tumours. So carcinogens, occupational we've mentioned, and viruses can also cause tumours. Now, different sorts of viruses might be affected, might cause tumours. We've mentioned human papillomavirus, possibly causing cervical carcinoma. Can cause warts as well, actually. They're benign, of course, but it can be caused by human papillomavirus. Patients who have had hepatitis B, more likely to get liver cancer. An Epstein-Barr virus can cause Burkitt's lymphoma, common in some parts of Africa. a tumour of the lymphoid tissue, Burkitt's lymphoma caused by Epstein-Barr virus. And as well as that, we also said that HIV can cause, can predispose to various types of cancer because of the immunosuppression. So patients that are immunosuppressed, perhaps due to viral infection, also more prone to all different types of malignancies. Diet, well, we've mentioned the positive aspects of diet, that we should have 5 portions of fruit and vegetables a day for the fibre and the vitamins. And the negative aspects, that it's probably best to eat less fatty food. Immunity we've already partly mentioned. People that are immunocompromised are more predisposed to different sorts of cancer, giving rise to the idea that some cancers at least might be caused by disorders of immunity. Now let's think about the aspect of hereditary again. Now it's certainly an observation that some tumours do seem to have a hereditary feature. Now, as we've said, sometimes these tumours are directly genetically inherited, and other times it might be an environmental effect. Like so for example, if parents smoke and the children are brought up in a smoky environment, in other words, the children are subject to passive smoking all their lives, and then start smoking themselves, then there's a pretty good chance that those children are going to get lung cancer. But that's an environmental effect. But people are also born with a predisposition to a particular condition. So someone might be predisposed to a particular sort of cancer, but by good lifestyle factors could probably avoid that risk. So these things aren't, as it were, written in tablets of stone. It's a predisposition to a particular tumour type. And by changing the environment and good lifestyle factors, then the risk of that tumour developing very often can be reduced in most cases. Although there are some tumours which do seem to be directly genetic, probably caused by so-called oncogenes, cancer-causing genes. So hereditary, a major factor. The challenge to think about, is it directly genetic? Is there a genetic tendency, or is there some environmental factor that can be avoided completely? And even if there is a genetic tendency, still is there an environmental factor which can contribute towards that? Because most diseases, if you think about it, are a combination of the genetic predisposition and the environmental factors operating on that genetic predisposition. So hereditary, certainly a factor. Hormones, as we mentioned, can be a factor. For example, patients on hormone replacement therapy are less likely to get uterine carcinoma, but more likely to get breast cancer on HRT after the menopause. Estrogen seems to be a promoter of breast cancer. Other environmental factors, well, we can think about geographical factors here. And we've mentioned that gastric carcinoma is more common amongst Japanese. Now, why is this? Why should it be that the Japanese get more stomach cancer than, say, people from the United States? Is it that the Japanese race is genetically predisposed to gastric carcinoma? It's possible. Or is it that there's something in the Japanese way of life which predisposes to something in the Japanese way of life that predisposes to the cancer? Which is it? Well, actually, we think we know the answer to this because studies have been done where people from Japan have gone to live in America, and the incidence of stomach cancer in those people reduces. And the incidence of stomach cancer in their children reduces still further. Even although they might still be 100% genetically Japanese, the children have less gastric carcinoma. And this is, we assume, because that they're adopting American lifestyle factors. For example, their diet would become American rather than totally Japanese. So it may be something in the Japanese diet, the high salt, and a lot of fish that they eat, for example, that might be predisposing them to these gastric cancers. Whatever, we think it's a geographical environmental factor. So many other environmental factors. You need to think about what cancers are there in your area and what environmental geographical factors could be reduced. For example, in the UK, some areas in some houses have a lot of radon gas. Now, radon gas is a radioactive gas produced by radioactive decay of rocks, and this accumulates in houses, and when it's breathed in, it's a very powerful carcinogen. It causes lung cancer. So is radon gas a problem in your area? Because if it is, all you've got to do is ventilate the houses properly, and the problem should disappear. Other geographical carcinogens are diesel smoke. Diesel fumes are carcinogenic. So people that live in cities tend to get more lung cancer than people that live in the countryside. So can we avoid diesel fumes? There's a lot to that, that involves changing transport policies and things, but I think these are all things that as healthcare professionals we need to think about. How could we reduce the amount of diesel fumes that are around in our cities? So lots of geographical factors can affect the types of cancer that you can see in your particular area. Environmental factors, geographical factors. Immunosuppression we've mentioned. Tumours seem to have tumour-associated antigens that the body recognises as foreign, and the body's own immune system can then attack these tumours. And when people are immunosuppressed, they get more cancers. So we know that good immunity actually plays a role in reducing the amount of cancers that we see. Age we've already mentioned, that most cancers get more common as we get older. But things like cervical cancer and breast cancer have peaks. For example, cervical cancer is most common at around about the age of 50. Below the age of 50 it's less common, and after the age of 50 again it becomes less common. But most cancers, the older someone gets, the more likely they are to get it. This is true with let's think, cancer of the esophagus, for example. The older the patient gets, the more likely they are to get esophageal cancer. It's also true with cancer of the stomach or pancreas. In fact, it's also true with skin cancer. What else? Rectal cancer, prostatic cancer, for example, become more common with increasing age. And I'm going to add one thing to the bottom of this list. I'm not really sure if I should, but I'm going to anyway. Bacteria. It's my view that bacteria can cause cancer in some circumstances. And the example here I'm going to give is that of the bacteria that can grow in the stomach, Helicobacter pylori. Now, we now know for sure, thanks to the work done largely by Barry Marshall in Australia, that Helicobacter do cause peptic ulcers. That is now beyond dispute. There is some debate about how many, but they certainly cause peptic ulcers. Peptic ulcers, of course, can potentially go on to become malignant. But as well as that, Helicobacter do seem to cause some other types of stomach cancer. So by eradicating Helicobacter, you can reduce the risks of getting certain gastric carcinomas from about 5% to essentially zero. So it seems that a bacterial infection early in life, the organ being colonized by a bacteria, can cause some cancers of the stomach later in life. And it's interesting, if this can happen with the stomach, maybe it can happen with other structures. We don't really know. But it's an interesting development that some bacteria are very likely, in the case of Helicobacter, to ultimately cause cancer. What we're going to do now is leave the specific causes, and we're going to go on and look at actually the theories of cancer etiology. And the main theory we're going to look at is called the multi-stage theory. the idea that you don't get a cancer as a result of one thing that happens, but it's actually a result of probably two things that happen. And this is called initiation and promotion. So let's now look at the multi-stage theory of the etiology of cancer. So here we're looking at a collection of normal cells. Normal cells comprising a tissue. And then what happens is that these cells are exposed to an initiator, something which initiates malignant change. It does not cause malignancy in itself, but it's referred to as the initiation phase. Initiation, if you like, gives the cancer the potential to become it gives the tissue the potential to become malignant later on. An initiator gives the tissue the potential to become malignant later on. In other words, it initiates pre-malignant changes. It predisposes to a malignancy later. So initiation phase. Initiation may occur as a result of exposure to tobacco, radiation or various chemicals. And once a tissue has been initiated, there's been initiation, this is probably irreversible because there is damage to the deoxyribonucleic acid. But at this stage, there is not yet a cancer. What happens after that is that the malignant potential, if you like, that occurred at the initiation phase is developed by the promoter, the promotion phase. So it's exposure to a promoting carcinogen which causes these cells ultimately to become malignant. And this typically takes place repeatedly over a long period of time. So again, smoking, as well as being an initiator, other chemicals in tobacco smoke are promoters. And it's the constant exposure to the promoter that causes these cells to become malignant. And it's interesting to know that at this stage,